Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on One. Joining me today is Dr. John McDonough, Professor of the Practice of Public Health with the Harvard School of Public Health. Well-schooled in both academia and government, Dr. McDonough is the author of a new book, his third, titled Inside National Health Reform. Welcome.
Thank you.
It's wonderful to have you and to have an opportunity to discuss this rather insightful book, which I had the pleasure of reading through this last weekend. Perhaps we can begin by asking, where were you when the healthcare reform bill was being hammered out?
So just to back up a little, before the national health reform process, I'd spent most of my career in Massachusetts, in academia, in the state legislature, and I was centrally involved in the formation of the Massachusetts health reform law in 2003, otherwise known as Romney Care to many people more popularly. And in 2008, Senator Kennedy, anticipating a drive to do national health reform, asked me if I would come down to Washington, D.C. and work in the Senate and try to help folks figure out how we might structure the national health reform. So I started in the U.S. Senate in June of 2008. I worked for the Senate HELP Committee, Health, Education, Labor, and Pensions, which is one of the two principal committees in the Senate with jurisdiction on health policy, the other being the Senate Finance Committee. So I worked there from mid-2008 through early 2010, and I left in early 2010. I spent some time here in New York as a visiting fellow at Hunter College, and that's where I was able to find the time to write this book.
So you really were there before, during, and after, and in a sense, at the very heart of the process.
Yes, and I really peg the official start of the process on June 22nd, 2008, when Senator Max Baucus and Senator Chuck Grassley from Iowa, Republican from Iowa, held a major summit on Capitol Hill at the Library of Congress to launch the health reform process. And it was a very positive, bipartisan day where everybody was saying failure is not an option. We all agree doing nothing is not an option. It was a very positive time that is hard to remember right now how much things have transformed, and as the feelings around health reform have become so harshly divisive and partisan. But it started out very optimistically, and so I started out at Senator Kennedy's request, and I was there through most of the process.
Your book is divided essentially into two major parts, the first of which describes the process in great detail and with remarkable insight. The second part is more about the structure of the law, and I just wanted to spend perhaps a minute about that. To the detractors of the Affordable Care Act, this is a monumental, structureless document that has been described either as incoherent or unwieldy or worse. What's your view of the Affordable Care Act, having seen it being generated, having pored over it obviously multiple times? What would be a fair description, would you say, of the coherence and structure of the law?
Well, several things. First, it is a landmark law. There is, I think, no doubt about that. Whether you think it's a landmark good law or a landmark bad law, it's a landmark, and its only peers, I believe, in U.S. social policy are the 1935 Social Security Act and the 1965 Medicare and Medicaid Act. So this is a law that doesn't come along every session, yes, every decade, every generation. This is once every other or every third generation, something of this scope. And the law is big, complicated, somewhat unwieldy, just like the United States healthcare system is big, complicated, and wieldy. And so if you're going to try to do comprehensive reform for a big, unwieldy system, the law itself, unless you want to throw it all out and start all over, is going to be big and unwieldy. I do a huge amount of talking around the country to all kinds of audiences of very informed people and regular citizens. And what I find across the board is everybody has a strong opinion about this law. They like it, they hate it, they like this, they hate that. Though very few people say to me that they feel like they have a good understanding of the law itself as a law. And so what I do in that second part that you reference is I get into the guts of the law to try to explain it. And the best way I can sort of describe it is, so just like a book has chapters, and an act has plays and scenes, and a baseball game has innings, a federal law, a federal statute has titles. And the Affordable Care Act has 10 titles. And when people understand the architecture of the law, the structure, and how those 10 titles work, the law makes a lot more sense, and it becomes more accessible for people to understand it. People have heard about this provision or that provision, but have no sense of a coherence of the whole. So for example, Title I is a revolution in terms of private health insurance in the United States. If it is implemented as designed by 2014, health insurance in the United States will never be the same. Title II is a revolution in terms of the structure of the U.S. Medicaid program and the relationship between the federal government and the states. Title III is some fundamental changes in our healthcare delivery system to improve the quality of care for all Americans and to make major significant changes in Medicare. Title IV is all about prevention and wellness and trying to create a structure where we try to help people and not just wait till they get sick. Title V is all about the healthcare workforce. Title VI, a little bit of a grab bag, fraud and abuse, transparency, elder justice, comparative clinical effectiveness research. Title VII creates a pathway for the Food and Drug Administration to approve what are known as biosimilars, generic-like biopharmaceuticals. Title VIII is a new national disability program called CLASS, or Community Living Assistance Services and Supports. Title IX are the revenues to pay for about half the law. And if you look at the law in that kind of a structured way, believe it or not, the law itself can actually become accessible and start to make sense, and you can actually begin to see what folks were trying to do and why it came together and why it is the way it is. And so what I try to do in that big second part of the book, I have a chapter on each of the 10 titles that tries to convey to people, what is this title, what makes it tick, why did it come together the way it did, what are some of the interesting, compelling stories that were involved in the creation and structure of that title. And so that's really the part that I'm hoping that people will have the patience to get into. I think if they have the patience and they get into it, they're going to be surprised by how interesting and compelling a lot of these stories can be.
And the simple point is that unless one actually appreciates the existence of such inner structure and the logic thereof, it is easy to get thrown off by this or that section, which is probably the most likely piece of the law that your average individual will likely be exposed to. Our viewers undoubtedly would be interested in what is expanded on in the first part of the book, and that is the relative role of the various actors in the drafting of the law, be it the legislators, the Hill staffers, the White House staffers, interest groups. How is that process transpiring in general, or even more importantly, how did it take place or shape up in the context of the healthcare reform bill?
So it was an immense process. It involved literally hundreds and hundreds of Capitol Hill staffers, hundreds of people from the administration, hundreds of members of Congress, and literally thousands of people, thousands and thousands of people who tried to influence and shape and direct this process. And again, if you want to understand who was most influential in which piece or not, you really have to almost look at it through the titles, because there are some interest groups that were heavily influential. So physicians, for example, were deeply involved, particularly in Title III, around the delivery system reforms and the quality of care and the Medicare issues in particular, and more tangentially involved in the others. But where they chose to put their effort and their attention, they were hugely influential in the process. They didn't get everything that they wanted. In fact, they didn't get the major thing that they wanted. The major thing that physicians really wanted was to eliminate the curious payment situation in Medicare and to eliminate this formula that's been lost since 1997 called the SGR, or the Sustainable Growth Rate, which has created this ongoing unfolding crisis in Medicare physician payment for more than a decade now.
Yet to be resolved.
They didn't get that done, and that was a major disappointment. And literally everybody, I think, wanted to do it, but at the end of the day, the price tag of resolving it was so high that it couldn't get through with all of the other pressures. But physicians had an awful lot to do in terms of the physician quality reporting elements of the law, the improvement of care in terms of readmissions, healthcare-associated infections. They were central players in a lot of that, as were the hospitals. So I would say pretty much any major organization that wanted to be a part of this process could get in, get at the table, and have influence. And nobody, I don't think you can say, I don't think any group got everything they wanted. Everybody came away with some disappointments, in some ways, as it should be. And but it's a controversial process. And you know, some people say, "Oh, it went so fast; they rushed it so much," and other people say, "Why did it take so long?" And the truth is, both of those perspectives are true, depending upon the frame of reference that you. It did take a darn long time, a lot longer than anybody thought it was going to take. I mean, when we were in the middle of it in the summer of '09, I said to some people, I said, "How long is this going to go on?" They said, "This will be done by Thanksgiving, Christmas at the latest, 2009. It got done at the end of March, 2010. So it went on for about 3 months longer than anyone imagined it could go on. And at the same time, it went pretty quickly as well, relative to some of the other efforts in the past, like the Clinton effort in 1993-94, which started in January 93 and didn't really come to its sad end until September of 1994, about 20 months later. So all those perspectives are true. But lots of key groups and certainly physicians had prominent seats at the table, and you can see their fingerprints and the results of their efforts throughout, not as far as they would like, but certainly in meaningful, significant ways.
Like any process that involves that many people, that long a time, there must have been high points, and there probably were low points. And you were in a unique position to observe and to pass some of those judgments. As you reflect, if you had to point out or pick a particularly rewarding high point, what would that be?
Personally, it was July 15th, 2009, when the Senate Help Committee, on which I was working as a staffer, finished one of the longest so-called markups, or the sessions where you consider the bill and every member of the committee has the chance to propose their amendments and they argue and fight it out. And this went on for about 30 days. This was one of the longest Senate committee markups in the history of the United States Senate. And a lot of folks thought that the process would just collapse of its own weight. And when we went through this process, we had about 900 amendments that had been filed by members, and any member could bring up any amendment they wanted. And the Republicans were, to a person, opposed at that stage of the process. And so it was not a friendly process. And when we did finally reach the end and get through, and we were the first committee in either the House or the Senate to finish deliberations on the bill, and there was this sense, yes, this is real, yes, this is moving forward, we might actually, after 100 years of failure, get something done. I would say that was probably a pretty significant high point for me personally.
That process was shepherded by Senator Dodd, I recall, and probably deserving significant credit. On the other end, if you had to think about a particularly disturbing low point in the process, what would that be?
I would say it was close following up to the high point of the Senate Help Committee finishing its markup. And a few weeks later, we went into August 2009, and it was the summer of those intense town meetings, yes, where the Tea Party folks made their first appearance and started this extraordinarily rancorous set of town meetings where there was yelling and shouting and pushing and shoving, and it got pretty ugly. And realizing that there was something going on, it didn't have the impact they thought it would have on Democrats in terms of freezing them, intimidating them, making them go back. It did, though, have that kind of an impact on a significant number of Republicans. There were two groups of Republicans as we got into this. There were one group who were very interested in making this work and finding a bipartisan solution. Perhaps, and I would single out one, I would single out Senator Grassley from Iowa, the ranking member on the Senate Finance Committee, who appeared on Fox News in June of 2009. And he was asked about the so-called individual mandate. And he said, listen, if we ever want to fix this healthcare system, we just have to be grown-ups and understand there's no way to do it without having some kind of a mandate in there so that people aren't gaming the system and forcing costs to rise. And we were all very heartened by that. And then 3 months later, in September, he appeared on Fox News, and he said the reason he opposes the legislation is because of the individual mandate. So what happened in those 3 months? Well, the most striking thing that happened was in the town meetings in August of 2009, when there was so much anger directed at him. I have a photo in the book of one of his constituents holding a sign that says, "Grassley, you're fired." And that's just sort of a symbol of, it was less aimed at the Democrats and more aimed at them. But so that whole month was a month of real concern and worry that the whole thing might be going down the tubes and we might end up once again, one more time, has happened so many times, 8 times before, where we go through this process and nothing happens.
Thinking for a moment about the longevity of the bill, and you alluded to it briefly earlier, you, more than most, are obviously aware that the bill is under legislative pressure, under legal pressure, and as of the creation of the supercommittee and the Budget Control Act, is probably under fiscal threat as well. 2 questions. First of all, as a true insider and with unique insight on the law, what is your sense, and I know prophecy is beyond our reach, but what is your sense of the longevity of the law, how it will emerge, if you will, on the other side with so many variables at play?
So many people are assuming that the fate of this law will be decided next year in 2012 by the United States Supreme Court. because of the federal lawsuits. And I think right now we can see that that prediction is probably not correct, because there are now 3 courts of appeals, 3 federal courts of appeals that have issued rulings. 2 of them have issued rulings favorable to the law, 1 unfavorable. But the truth is that all of the contested terrain within the law right now boils down to just one section in Title I, which is the individual responsibility requirement,
yes,
or otherwise known as the individual mandate. All right? So my belief at this point is that far more significant than what the Supreme Court does is what will happen on November 6th, 2012, the next federal elections. Because let's consider 2 hypothetical situations. First, let's assume that the U.S. Supreme Court upholds the individual mandate, says it's constitutional, no problem, so all the legal action's done. And let's say that in November 2012, Republicans hold the House, take the Senate, and take the White House. I think it is fairly reasonable to predict that early in 2013, the Republicans will come in and through some kind of a budget reconciliation vehicle where they only need 51 votes in the Senate, will repeal most of the Affordable Care Act. Certainly all of the big expansions of Title I and Title II, all of the revenues to pay for it, a large part of this law will just be gone if they do that. So let's consider the other. Let's say the Supreme Court sometime in 2012 strikes down the individual mandate, says it's unconstitutional. And let's say that in November 2012, Democrats hold the White House, hold the Senate, and take back the House. I think it is fairly comfortable to predict that in that situation, in early 2013, the Democrats will come in and through a budget reconciliation vehicle where they only need 51 votes, they will change one word in Title I of the law. They will change the word penalty in the individual mandate to tax, or just add the word tax and make it tax penalty. And if they do that, there is no constitutional issue relative to the law because it is a tax and Congress has pretty broad authority to raise taxes. And so what we are seeing, what we're leading up to is something really extraordinary in American political history. And I can't think of a parallel where November 6, 2012 is almost going to be a national plebiscite on this law. Now, most people who go to vote on November 6, 2012 will be voting on the economy, on who knows what, gay marriage, foreign policy, whatever, not on the Affordable Care Act, though the results of that election, if they go one-party rule in either direction, will be profoundly influential in terms of the fate of this law. So this is really new territory and a new political kind of event that I can't see a parallel to in legislative political history.
Putting aside these, I think, very possible scenarios and isolating the discussion and focusing on the Budget Control Act, what threats, if any, do you see from that process, which is bound to create some cuts in the budget by one mechanism or another? What implications do you see in that process to the Affordable Care Act?
So in terms of the process with the super committee
Supercommittee.
that is going on right now,
or the alternatives to it.
Right. Under any scenario related to the super committee, there may be some slight damage to the Affordable Care Act and no major significant damage to it. If the automatic cuts take effect, the access expansions in Title I and Title II will not be touched. And most of the other aspects of the law will stand. And it is hard to conceive of the Democrats on the super committee agreeing to changes which would represent a significant undermining of the law. So we don't really see that. In some ways, I'm reminded of Bill Clinton in his early years. If you remember what happened with Bill Clinton, 93, 94, a lot of activity, a lot of stuff got done, not health care, but a lot of other stuff. ran into tough midterm elections, lost the House and the Senate. And then 1995, 1996, a lot of sound and fury, a lot of people arguing, government shutdowns, all kinds of things. And in truth, substantively, little or nothing happened in those 2-year period. And then the presidential election happened. We saw Clinton was reelected. The Republican House and Senate were reelected. And they came back in 1997 and they did business. And the Balanced Budget Act and things got straightened out. We can almost see a parallel. So Barack Obama had 2 very productive first years, including getting health reform done, ran into political trouble in 2010 around the economy, lost the House. And now we're seeing a replay of 95, 96 with a lot of smoke, a lot of fury, a lot of thunder, people arguing with each other, all big dangers and people running around, with their heads getting cut off and stuff. And at the end of the day, I think at the end of this 2-year period, we're going to look back and say, there was a lot of sound and fury and very little got done. And then after the presidential election, we hope in 2012, people will say, okay, time to come back and get some real work done.
At the least, one would have to say that this is an incredibly fluid time in American political history in general, and in healthcare in particular. Which brings me to my penultimate question, that is, were there historic precedents of repeal of a healthcare law of consequence? And I know there weren't too many.
No, but there's one.
Perhaps our viewers might benefit from just a quick historic refresher of one that did not last.
Yes. So in July 1988, Ronald Reagan's last year as president, with bipartisan support, overwhelming bipartisan support in the House and the Senate, President Reagan signed the Medicare Catastrophic Coverage Act, the biggest set of changes to Medicare since the program had been created in 1965, including the creation of a prescription drug plan for Medicare enrollees and a lot of other really important benefits, and a financing plan which had higher income Medicare enrollees paying higher premiums than they had been paying. And after the law was passed, the higher premiums went into effect right away, and the benefits were put in down the road. And as the higher payment requirements came in on those higher income enrollees, they had a revolt. And an immense political storm ensued. Lots of folks ended up protesting the law who weren't subject to those higher payments at all. They assumed that they were going to be, and they weren't. And there was such a storm that less than 18 months later, in November 1989, President Reagan's successor, President George H.W. Bush, signed into law a complete repeal of the Medicare Catastrophic Coverage Act. Happily, right now, the Affordable Care Act has lived a longer life since its signing than the Medicare Catastrophic Coverage Act, but it certainly is a historical precedent that gives pause. And that is one of the reasons why in Title I of the law, there were a set of changes to insurance markets to benefit consumers that went into effect within 6 or 9 months of passage of the law to try to avoid that ugly precedent from 1988 through 1989. So, for example, beginning in September 2010, parents could keep their children up to age 26 on their family health insurance policy. And according to the census data that recently came out, we've now had more than 500,000 young adults take advantage of that single provision. And while for just about every other age cohort over the prior year, the rate of uninsurance has gone up, for young adults, the most difficult population, the part of the population with the highest rate of uninsurance, actually dropped between last year and this year by 2%. So we can see those benefits, and there are a lot more. There's closing the donut hole for seniors.
Bill of Rights.
Yes.
The lesson is benefits first, penalties later.
Yes.
And beware the wrath of Medicare beneficiaries.
Absolutely.
On a personal note, if I may, you were a state legislator, an NGO executive, an academic, a Hill staffer, and an author. Can you connect those dots for us? What is the common denominator of this very rich professional life that has many good years to go?
I would just say I think I have real trouble holding down a job. But I'd say the string that ties it together is the relentless desire by so many people in the United States, and yourself certainly included, to try to improve the U.S. healthcare system, which has just so many flaws and so many extraordinary opportunities for improvement. So I became a friend back in 1991 when I was in the Massachusetts legislature of Dr. Don Berwick, who is, at least until the end of November, the administrator of the Centers for Medicare and Medicaid Services. And one of the things I remember I learned from him right at the start was just a little saying. He said, every defect is a treasure, because every defect provides the opportunity to improve things and make things better. If you can't see the flaws and the defects, then you don't know what to fix. And so with our healthcare system, we have so many abundant, glaring, monumental flaws. And so we have extraordinary improvement opportunities. And since I internalized the quality improvement paradigm back in 1991, I have been one of the journeyers on the path to try to figure out how can we improve this system and make it work better so that people get the health care services they need, we prevent care, and we do right by patients and healthcare consumers. And that's what's driven me in all of my various pursuits.
So the challenges and the opportunities both. Thank you.
Thank you.
On this note, sincere thanks to Dr. McDonough and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Adashi.